everyone. Welcome to Caldwell Chats. My name is Bailey, and today I'm here with Katie Rubino, who is one of our attorneys here, and then Daina from Epidaurus. We will be discussing blockchain in healthcare, which I personally am really excited to learn more about. So my first question to both Daina and Katie, what is blockchain and what trends are we seeing in blockchain innovation?
Sure. So a blockchain, it's a distributed, secure form of record keeping. It's a type of data storage. And the advantages of blockchain is that there's not a centralized record keeping. So there's a lot greater security with blockchain usage because it's more of a distributed system. And on the innovation side, what we're seeing here are a lot of new technological advances coming out using blockchain, particularly in specific industries like the banking industry, healthcare that we're going to talk about today, and a lot of different other applications of this technology.
Yeah, just to add to that, I would say it started out as a encrypted, as Katie said, decentralized database, essentially, for tracking sequences of exchanges of digital value, namely Bitcoin. And so it started out sort of it's a technology solving a problem in the underworld. And over the last 10 years, it's evolved, and now we're seeing it just an explosion of innovation and blockchain applications in enterprise, especially with regard to smart contracts. It also enabled embedding smart contracts into this shared infrastructure so that you can actually automate exchanges of information according to contractually based rules. I would say the most successful use cases in enterprise that we've seen so far have been in supply chain, financial auditing, financial reconciliation for trading, and now the new frontiers, of course, where people are working really hard is healthcare, which we'll be discussing today.
Right, totally, and definitely excited to dive more into that. I would say that, mainstream, it's a lot of crypto and things of that nature that we're seeing. So to really dive into the healthcare portion of things, Katie, what types of innovations are we seeing in healthcare where blockchain is being implemented? As the chair of the life sciences practice here at Caldwell IP and being a patent attorney, are you seeing any general trends in this space with IP?
I'd say particularly we're seeing a lot of usage of blockchain to help solve some of the HIPAA compliance rules of keeping data secure, keeping it safe, and also allowing patients to have access to their information from remote areas. I think especially with the COVID pandemic, the greater acceptance of telemedicine, we're going to see even more acceptance of blockchain in the healthcare setting. And I'd say the other area we're seeing a lot of innovation is how can we use blockchain to kind of create a centralized form of record keeping, because in the healthcare industry, there's a lot of problems with maybe a particular hospital system uses one type of electronic health records and another hospital system uses a different type, and they can't talk to one another. There's no communication between the two softwares. So blockchain can kind of help resolve some of those issues by creating this centralized record keeping that uses one system that can be integrated across the spectrum.
Very interesting. Daina, did you have anything that you wanted to add in there?
Just to echo, that it's very helpful for, I think, creating a more patient-centric system. Pain point for patients today is this is very sensitive data, and they don't really necessarily feel like they have ownership of it. It's in multiple locations, but it's highly sensitive, and even just HIPAA aside, I mean, it's not being used to its full potential. So finding that balance, finding the right tool that allows us to, on the one hand, share the data so that we have more coordinated, higher quality care, while that data is also protected and the patient can trust that it's only, in the right hands at the right time. That's where blockchain can, I think, make a big difference.
For sure, super useful. To kind of piggyback off of that, Katie, what issues are innovators or innovations using blockchain, aiming to solve in health, and how?
I'd say probably one of the areas we're seeing the implementation and acceptance of blockchain to solve problems is in the pharmacy industry, and that's somewhere Daina's innovating a lot in that space, where coming soon in 2023, every drug that is manufactured for human consumption is going to have to be somehow tracked and recorded from the time those raw materials are purchased through manufacturing, through delivery to warehouses, to pharmacies, and ultimately to the patient. So having some kind of way to keep track of all of those stages of the life cycle of a drug, I think that's where blockchain will be very useful. And also using blockchain to kind of help transform the pharmacy benefits manager side of things with insurance reimbursement, coming up with fair prescription prices. I think we're going to see a lot of new utilization and acceptance from that forefront.
Awesome, great. And Daina, I would love to learn more about Epidaurus and how your company is implementing blockchain.
Sure. So Epidaurus, I'm a co-founder and head of product at Epidaurus. We founded Epidaurus in November 2019, just before the pandemic hit. Initially, we started very broad. We were just looking for a use case in healthcare involving electronic health data, and through our customer discovery process, and also just following the market. Definitely a hot issue, as Katie already mentioned, is reimbursement for prescription drugs, the problem of rising prescription costs. So we were digging into the why of that, and quickly discovered that you have this very complicated system with lots of financial intermediaries controlling the reimbursement channel, and it's pretty much completely invisible to the end consumer, as well as to payers who are independent, such as self-insuring employers. It really depends on the relationship that the payer has with the intermediaries, how much information they actually have. But there's this huge information asymmetry. So there we saw this opportunity to develop or adapt blockchain technology as it is today to this particular use case. Basically, our goal is just to render that reimbursement channel more transparent, both to independent plan sponsors and payers, as well as those plans beneficiaries, so that beneficiaries can make better informed choices with their doctors as to, one, not only what medication is most clinically appropriate, so leading with that, but then also most cost effective. And our hope is that once we test it, that the results will show that with more information, when more people have more information that's accurate at hand to make decisions at the ground level, it's also going to impact at the collective level or the administrative level, and you're going to see increased plan savings because people will just have better information at hand to make these everyday decisions.
Great. So piggybacking off of that, what would it mean for a patient to have like a self-sovereign health record, and how does blockchain technology enable self-sovereignty?
Sure. So a self-sovereign health record basically would just mean that the patient, as I said before, has more control over their personal data. So, and that they are able to verify their digital identity across multiple systems. So multiple health record management systems, because they're anchored, for example, in a blockchain that enables the verification of that digital identity. And also that digital identity will always be up to date with the latest user information because everything will be synced. So that's what self-sovereignty would mean in the healthcare context.
Right, and then I know you had touched on this briefly, but what problem does Epidaurus aim to solve, and exactly how does blockchain help to achieve this?
Pricing transparency for prescription medications, and also information asymmetry between payers and pharmacy benefit management entities within reimbursement channels, which today are pretty opaque and not open.
Right, yeah, I have a background in clinical healthcare, and I can say that that's definitely there's room for improvement there. So anyways, what is a federated blockchain and federated learning?
Sure, so the first blockchain ever, which was the ledger for Bitcoin, was a public blockchain. And then as blockchain was being adapted in enterprise, public didn't make sense. Public essentially means anyone has read-write access to that shared database, which you can't have in an enterprise use case. So a private blockchain concept emerged where you had one organization controlling the blockchain. But as we said earlier, what is a blockchain and what value does it bring? Well, it helps decentralize information exchange. But when you have one organization controlling all the data, then it's no longer really decentralized. So a federated blockchain is a hybrid of the two, where you have controlled read-write access for known permissioned entities, but across multiple organizations. So you still maintain a certain level of decentralization, but it's permissioned, so it's more appropriate for business. And the other trade-off or advantage to having a little bit more less decentralized, say, than a public blockchain is that for processing and efficiency, it's lighter and faster, so you can have faster transaction processing, which is also important in a business context. Federated learning is, again, it's a form of machine learning where instead of deploying an algorithm to a centralized location, you're deploying it across multiple decentralized locations. So instead of having to pull sensitive data and have it all in one database, one node, you can send out your algorithm and have it run across multiple nodes across this federated blockchain network.
Very helpful explanation. And I guess to round things off with this, how can blockchain technology support and encourage strategies of cooperation over competition, for example, business incentive alignment and things of that nature?
Yeah, that's really tricky, and it's something that we're grappling with a lot in our own work at Epidaurus. But it's a fascinating space or area to reflect on. I think basically where you have independent entities trying to work together, there's always a certain degree of uncertainty. But that also becomes the perfect, I guess, opportunity for testing a blockchain, because if those two independent organizations stand to benefit from sharing information for the purposes of a process to run more optimally, again, it's a great opportunity. So how blockchain encourages that cooperation, essentially, I would say, right now is that it provides a foundation for these two independent entities to capture data, manipulate data on-chain according to a shared formal model. And in that sense, any data that goes into that ledger while you can't guarantee that it's flawless data or completely trustworthy, you at least know that it's gone through a certain protocol that everyone's agreed to, or a shared formal model. So in that sense, it is vetted, and in that sense, it creates trust and encourages cooperation.
Perfect. That makes total sense. Thank you. And do you have any advice on formulating a patent strategy in the blockchain space? And, Katie, obviously feel free to pitch in on this as well.
Sure, yeah. Thinking on that, I think my main advice would be blockchain is the technology we've seen evolve a lot over 10 years, but and technology changes really, really rapidly. And 10 years seems like a long time, but it's still a very young technology, and I think it has a long ways to go. And so there's a lot of room to play with the different elements of it and adapt it to different use cases, which makes it a really exciting space to play in. So my chief advice would be when developing a patent. Basically our strategy was to hone in on the business use case first and really define the requirements as well as we could, and then take what we know of the technology as it is today and sort of mix it up, adapt it so that it fits exactly the requirements of the use case as we researched and defined it. And that's, I think, your best shot at creating something new.
Absolutely.
I would just say, too, to add on to that, there's a lot of innovation happening in the blockchain space. We're seeing more and more patents being filed and becoming published year in and year out. So I think from an IP strategy perspective, getting something filed sooner, getting that priority date on record faster is always a good idea. And also, particularly because this is a technology, as Daina mentioned, that is getting it's still very novel, and more aspects of it and use cases are becoming invented every day, that thinking about strategically considering things like a track one expedited filing can be very helpful, because it's going to get that innovation through the patent office much more quicker than a regular patent filing, where it's going to go sit there for 3 to 5 years before it's reviewed and before we hear anything from a patent examiner. Where the track one, this can be, sometimes we can get a patent in as quickly as 6 to 12 months with one of these filings. And for a startup that's moving quickly, that maybe needs to raise some funding or wants to lure in potential investors, or just maybe monetize their IP that they acquire, these track one filings can be a great opportunity to really get something through the patent office quickly, so that our innovators can continue to build their business and continue to hone in on the IP as more and more of the innovation is refined over time.
Great. I think that was super insightful for those who are listening. And, I appreciate you both with all of your feedback. To round things off for today, my last and final question would be to both of you. What are some hurdles and challenges that face blockchain in health, and how can health tech startups overcome these hurdles?
That's a good question. I'd say probably from the patenting IP perspective, clearly defining how the blockchain plays into your invention is very crucial. So if maybe you're doing something unique in storing particular sorts of data on the chain, off the chain, emphasizing those types of points can be really help kind of zone in on those patent claims and really help get towards an allowance much more quickly if we're defining and really emphasizing the novel features of that blockchain being integrated into some type of healthcare innovation or healthcare use case.
I would just quickly add from the business and product development side that the healthcare industry, as we call it, has over the last couple of decades, I think it used to be There were a lot of smaller hospitals, smaller practices, but we've seen a lot of integration over the last years. So hospitals have become these really powerful conglomerates, or in the benefit space, you have these huge companies that control huge swaths of supply chains and reimbursement channels. So it's really hard for small and new companies to get in and find their niche. But I think the way to overcome that hurdle is to find a partnership, so that you can at least get a footing, because as we said, there's room for the blockchain to encourage cooperation, democratize the system a little bit, but you have these really powerful entities in place right now that don't want to give up that power. So I think the biggest hurdle is convincing them to come and play with this new technology and show that there is actually a benefit to everyone, including the big players, in testing this out.
Right, definitely. Well, I thank you both for your time today, and special thank you to you, Daina, for taking the time to join us with Caldwell Chats. Looking forward to hopefully continuing this conversation in the future. Thank you.
Thank you.